So, Mike, let's start with these new SARS CoV-2 variants, which were identified recently in England and South Africa and appear to be more transmissible. What do we know about these variants? What do we need to learn? And how concerned are you?
Well, recall we've been talking about the virus, in a sense, mutating, that term that tends to be scary to a lot of people, since the very beginning of these podcasts. Coronaviruses are not like influenza that go through reassortment. Rather, they continue to add on changes that occur because of mutations, deletions in certain genetic information on the virus. And because we have not had a previous pandemic with a coronavirus, we've not really understood necessarily how that viral evolution would play out with this pandemic. And only recently have we talked about variants, those viruses that have continued to change genetically as to how they might impact the spread of the disease or even the severity of the disease. And there have been a number of papers written over the course of the past few months about previous experiences with a certain variant that became much more common in a given area, and whether or not that meant that these variants were more infectious, or were they in fact causing more severe illness. More often than not, we came back to the conclusion that what was really happening was the virus transmission was occurring in groups very vulnerable to high risk of transmission, meaning the crowded living conditions or where they worked, and that it had less to do with the virus itself. Well, now I think we've come upon a new time. We now have variants which raise serious challenge to, one, can this virus get more infectious? Two, can it cause more serious illness? Three, can it avoid some of the testing methods that we currently use, where we actually use certain genetic targets on the virus for the purpose of that test? And four, will it have some impact on how well our current vaccines and the immune response that we elicit from that vaccination actually protect us against these variants? So let me just back up a little bit and just kind of tell the story. On average, between 5 to 10% of all the SARS CoV-2 viruses have routinely been sequenced in the UK overall, much higher than the rate here in the United States. And about 4% were routinely sequenced in the southeast England area since the beginning of the pandemic. From early October to that early part of December, over 50% of the isolates identified as the variant strain in southeast England. That compares to just a few percent at the beginning of the time period. And it was with the actual increasing cases that were occurring, even in what they called lockdown, and also seeing increased infections in 10 to 18-year-olds, that actually highlighted the need to look at these from a genetic standpoint. And that's, in fact, how these were picked up. Now, if one looks at how these have changed, and I'm not going to go into the details of the 23 mutations or the key 14 mutations resulting in amino acid changes and deletions, but the bottom line message is that something very significant is happening in the UK. And this is why the concern was expressed as it has been on a global basis. I believe that the data are, to me, compelling, showing that there is truly an increased transmissibility of anywhere from 40 to 70% of what the previous virus strains were able to do. Now, it doesn't mean that they get transmitted in any different ways. It's just that they're occurring at a higher frequency, likely because people actually have a higher virus load. That is yet to be fully determined, but that surely makes sense. And right now, lab studies are ongoing to determine whether these viruses have different properties than we've seen with others in terms of transmission. We don't have adequate information at this time to say absolutely yes, there's more transmission, but I believe in the end that this will be found to be the case. Also, there are studies going on right now to understand whether or not the illness is more severe in these individuals. Now, remember, when we say that there's no evidence yet of increased severity, most of these cases with this new variant have occurred in the first 2 weeks of December. So when we think about lagging indicators, and we've talked about this many times on this podcast, of the fact that you get infected today, you get clinically ill 5 to 6 days from now, you become seriously ill, needing hospitalizations potentially 5 to 7 days after that, and you still live for, unfortunately, only 2 more weeks, and at that point, you die. Well, if you look and put that entire time sequence together, we wouldn't know yet of what's happening in England with the severity of this illness for probably another couple of weeks. And we're surely seeing that as a lagging indicator of deaths in the United States with the big peaks that we see. So I think the verdict is still out about that one with this particular variant. In terms of the vaccines, and does it have any impact and how well it protects, the general sense by most is that no, it won't, in terms of at least causing vaccine failure. Today, there's more discussion, particularly among some of the molecular geneticists looking at this, suggesting, well, maybe it might reduce the level of protection. I think we have to be very, very careful here. We don't know that yet, but it is being investigated. And we do know that the companies, if need be, could actually redo their vaccines for a new variant type, and it could be done within a few months. That would mean potentially in the short term, if in fact this were the case, and again, I want to be very, very clear, we don't know this to be the case. If necessary, we'd have a few months potentially with a reduced level of protection from what we saw earlier with that 95% protection. So these are all questions that yet have to be answered. Now, at the same time that this was happening in the UK, and of course, as you know, cases have also been now seen in Australia, Denmark, Italy, Iceland, and the Netherlands from this UK strain. We've also seen a situation occur in South Africa. And in South Africa, the virus variant there is 501.V2. This 501.V2 variant was first recognized in Nelson Mandela Bay, then spread across other parts of the Eastern Cape to the Western Cape along what is called the Garden Coastal Route and into the southeastern part of the country. Since early November, it's been spreading rapidly as the second major wave in the country is now starting in southern hemisphere summertime. What we realize are these are different variants, but it appears that some of the same challenges that we see occurring in the UK are occurring here. A preliminary manuscript is under peer review right now, but it was posted on what's called CRISP.org, a site launched by a network of laboratories, scientists, and academic institutions in South Africa that have the aim of sharing data for public health responses. In this manuscript, and as well as information provided in the African Center for Disease Control and Prevention website, states that studies are underway to see if higher viral loads are associated with this variant, as well as whether it causes more severe illness. A number of healthcare workers believe that is the case. And again, the question has come up, was there any impact on vaccine efficacy, antibody efficacy, or even diagnostic test sensitivity? This is the beginning of a new phase of the coronavirus pandemic, namely that of seeing these variants develop that pose challenges from a standpoint of transmission and potentially from vaccine. Now, I will say right now, and I have no specific expertise to say this, is my sense, that we will show, number one, that there is increased transmission. There may or may not be increased severity. I think that there likely will be. I think we're going to show that younger age groups, particularly the 10 to 18-year-old age group, are going to be more impacted by this virus than what we've seen before. Number four is, if there is any impact on vaccine efficacy, I think that it will be somewhat muted. It won't mean that the vaccines won't work, and we'll have to come back and look at that. And last but not least, these are going to spread around the world. I am quite certain this is spreading in the United States right now. Unfortunately, we have done a terribly inadequate job of genetic sequencing here in the United States. Just to give you an idea, there's a web area that we deposit genetic sequences for viruses, and specifically for this one. Since December 1st, the U.S. has published 37 sequences for the coronavirus in the U.S. to this website. Meanwhile, the UK has deposited 3,774. They've been way ahead of us. Even the South Africans have been. So we don't know what's going on in the United States right now, but it wouldn't surprise me if the variant's here. So what does this all mean? What it means is that we have to understand the importance of everything we've been doing to date to reduce transmission. All the discussion that we've been having doesn't change anything. Distancing, understanding the layer effect, don't swap air. The idea of public gatherings, people coming back into the public setting, will only enhance this. And why is this so critical? Well, from the very beginning, we've been talking about, why are we trying to do anything about this virus? And I think our last gasp effort to do something was always about don't let our hospitals collapse. And again, you're taking the term collapse from my perspective as meaning the inability to provide high quality care. And as I just shared with you in the opening, as we see in so many states in this country right now, the number of hospitals that are on the edge right now, states like California, Tennessee, a number of states, imagine if we were adding 20 or 30% additional cases for all the same kind of risk behavior that we were doing before. Now, I don't know that's the number, but when you look at what's happening in both South Africa and the UK, where these variants have emerged, they surely give us warning that this is now the time, it's now our time to do even more to try to limit transmission. And let the vaccines do what they can, and hopefully within the next week or two, we're going to have the information to say, no, the vaccines are still going to work here. But this is a huge challenge before us right now. So it's not insurmountable. It's not a fatal flaw to our plan to get to that sunlight next summer, next fall. But it means if there was ever a time now that we need to tighten up what we're doing, it is right now during this season. We'll keep you updated on what's going on with these viruses and what this means in terms of our public health programs and what it means in terms of protection. And I also just want to emphasize that, from a control standpoint, you're going to hear a lot of people being critical of we should do this or do that, close borders, whatever. I would do whatever I could to slow down the transmission of this virus from coming to other countries in the world. I'm certain that the virus is here. It's going to spread here just like it is elsewhere. And if borders were closed down, we might slow things down by a week or two, maybe. The bottom line is we have to be prepared now to know that we could see a surge on a surge with the holiday season because of these. And this doesn't change our efforts, as I've said before, but it surely adds a new wrinkle to them. And we'll keep you posted. And let's just hope that we don't see the impact of these variants in a way that surely could happen. The other piece I just want to say is even if we get through these variants and we pick up our game, we're going to have new variants. New ones are likely to emerge. But again, remember, we're trying to get to the end of that tunnel. There's light there.